Okay. Hello, everyone. Welcome to Being Patient Brain Talks. I'm Deborah Kahn, founder of Being Patient. Today, we're going to talk about the link between diabetes, tooth loss, and dementia. Now, you may not put any of those things together, but believe it or not, there is truly a link that more research is going into oral hygiene and how that's related to brain health. So I'm really excited to do this talk today with Dr. Bei Wu. She is Dean's Professor of Global Health and Vice Dean for Research at NYU's Rory Meyers College of Nursing. Dr. Wu, thank you so much for joining us.
Thank you, Deborah, for the invitation.
Okay, let's start first with oral hygiene, because I have now heard a number of studies citing the importance to oral hygiene and brain health. What's the link there?
Yeah, oral hygiene, you know that if you have a poor oral hygiene, most likely that will cause, periodontitis, and ultimately that if you have a long-term kind of periodontitis, severe periodontitis, then actually the outcome is tooth loss. So that increasing evidence, including ours, that our team has been looking into this area of research, looking at kind of poor oral health in relationship with cognitive decline, dementia, over more than a decade, actually more than 16 years that in this area of research, that increasing evidence suggests there's a link that poor oral health is a potentially risk factor for cognitive decline and potentially onset of dementia.
So specifically though, if you have lost a tooth, then obviously you have a hole in your gums. What does that mean? Does that mean bacteria can actually get to our brains, or what is the risk there?
Yeah, there's several kind of potential pathways. Think about what's the kind of linkages. Certainly one is that this bacteria, right? So tooth loss, because it's more so as actually periodontitis, that the bacteria that are causing the onset of periodontitis. Then that actually this is one way to this bacteria could potentially affect your brain function. This is one kind of hypothesis. And some bench scientists have found some of these linkages that certain bacteria deposited in your gum that could potentially harmful to your brain. So the second kind of hypothesis and pathway is linking nutrition intake. That we know that once you have a higher number of tooth loss, that you have unlimited functional teeth, then that certainly will affect your nutrition intake, right? So if your nutrition intake, then there's a linkages between kind of a poor dietary intake and will affect your kind of brain function. So this is kind of second kind of hypothesis pathway. The third one is inflammation. That is a common kind of cause, because that actually is also related to diabetes, which is diabetes and poor oral health has one common link is through inflammation, that these are causing higher level of inflammation, and the inflammation actually is related to brain kind of poor brain function. The fourth actually hypothesis is also through some common chronic conditions like cardiovascular disease. Diabetes, poor oral health that links cardiovascular diseases, but cardiovascular diseases, this is actually very strong evidence suggests that stroke has very high risk of dementia, right? Risk and cardiovascular disease. So these are some kind of potential linkages or pathways we call.
So specifically, I want to just go back to the diabetes, because we know that people with diabetes type 2 are just at a much higher risk of getting dementia. And that makes sense because of glucose regulation and, how our systems are related. Glucose very much is the fuel for our brains. And if you have a diabetes, it means that your glucose levels are off in very layman's terms. But is tooth loss a symptom of diabetes? Is that, do diabetics tend to lose their teeth more so than people without diabetes?
This is a very interesting question because in 2015, our team conducted a study, which is actually very well cited and got a lot of media attention, is that we use national data. It's called Enhanced National Health and Nutrition Examination Survey, and they link 40 years data together, start from 1970s to actually up to 2010s, more so it's a 40 years study. We found that individuals with diabetes look at 4 racial ethnic groups: white, Hispanic, African American, and Asian population. Actually, 3 major racial ethnic groups: Hispanic, Black, and Hispanic, Black, and white. We found that consistently across these 3 groups, individuals with diabetes has twice the times in terms of number of tooth loss in comparison to without diabetes. 40 years of data, national sample, that found that this is across these 3 major groups, consistently found that individuals with diabetes as way more doubled kind of number of tooth loss than those without diabetes. So
do we know why that is? I mean, that's fascinating, but do we know why? What is it about the diabetes and that would make your teeth fall out? Like what?
Yeah, it is a common kind of pathways as a potential inflammation, because for individuals with diabetes that they have a higher level of inflammation, but also for tooth loss, as ultimately it's a chronic periodontitis. You have a severe periodontitis, your inflammation level is high. So then ultimately this kind of tooth loss is the outcome. Once you have a long-term severe periodontitis, as a dentist will let you know that, right? So most likely that your tooth will fall out if you don't take care of this. So that's what this is, the information that linkages with that.
So Dr. Wu, tell us about what this specific study that you published found with the link between both tooth loss, diabetes, and dementia. Like what was the link?
Yeah, right. I think that we speculated this common linkages is, again, information and potentially that high linkages with nutrition intake, because diabetes, people being like diabetic that most likely have a poor kind of nutrition intake. So you need to control your kind of nutrition, but oral health, right? Poor oral health affect your nutrition intake as well. So you have a nutrition intake as one kind of a common link. You have inflammation as a common link. So, and you also have cardiovascular diseases as a common link between these, right? So what we found, that's why why we actually launched this study. The purpose of this is look at, poor oral health and diabetes are very common among older adults. But then the hypothesis, and we found that diabetes is a strong risk factor related to dementia, and the poor oral health now increasing evidence to suggest this is a kind of a high risk of dementia. But then they say, we're looking at these older adults potentially have multiple chronic conditions. It's just not having just one condition, each individual, right? So we're looking at how this comorbidity, for example, how this co-occurrence of you have poor oral health and kind of diabetes, then what's the kind of jointly, what's the impact on their dementia, right? And the cognitive decline. So that's how we kind of start looking into this, whether this is any joint effect, whether there's a joint effect. And from our study that we did find that jointly that you have a poor, like we call this edentulous, means like complete tooth loss. So you have individuals with complete tooth loss and those with individuals with diabetes. Now this is that's the combination of this. But jointly, they have actually worse, they have a higher risk of cognitive decline compared to those individuals who have the condition, each of condition alone. For example, that I only had the diabetes, but I still have some teeth, versus I still have some teeth but I don't have diabetes. So that's a combination, right? So both condition in compared to within only one of these conditions, then also without any conditions, we found that this is a kind of almost like a linear effect. You have the both condition has the highest risk. Then you have one of each condition is worse. Then you have a kind of no conditions is that kind of in a better condition than two others. So
Right.
that's what this is kind of, we find some joint effect of the co-occurrence of this.
Okay, and yeah, sorry, go ahead.
But what we also found interestingly was whether actually diabetes, we already have many very strong evidence to suggest diabetes is a risk factor of dementia, but not so much on poor kind of oral health and the tooth loss. We found in our study actually tooth loss and the complete tooth loss even have a more accelerated decline of cognitive function than diabetes.
Right.
So that's what I find it fascinating to think about. Wow, this is right, because you think diabetes is already well established kind of findings, but what about complete tooth loss? We actually found to have a higher risk.
Yeah. So this is naturally the next questions are coming in, and this is, I'm not sure you can answer this, but we got a question of someone asking, I want to know more about the loss of teeth. For example, if your dentist says you need to get your upper teeth pulled and get false ones, does that speed up the decline from Alzheimer's? And another question, which kind of highlights the same sentiment, which is, just having dentures for 40 plus years, being diagnosed with dementia, and forgetting to clean dentures daily make dementia worse? So do we know what that direct link is for people who might have already had to have their teeth pulled? Are they at a higher risk of a steeper decline if they've already been diagnosed?
Well, this is an interesting question. We actually 2 years ago we published a systematic review, look at so far like what's the kind of the current findings on kind of tooth loss and decline of cognitive function with mild cognitive impairment and dementia, onset of mild cognitive and dementia. We did find that actually, yes, that well, I can show you some kind of statistics here that it showed that adults with tooth loss compared to no tooth loss had a 48% higher risk of developing cognitive impairment and a 28% higher risk of being diagnosed with dementia. But also that we found that when you look at kind of dosage effect for additional tooth loss, for example, each additional missing tooth was associated with a 1.4% increased risk of cognitive impairment and a 1.1% increased risk of being diagnosed with dementia. Having said that, we also found interestingly that if individuals have denture, functional denture, actually that the risk was not significant.
Interesting, because maybe you have like, even if they're not your real tooth, you have something filling that hole and it's less of a pathway, right?
Correct. So that's why it's for public health kind of intervention to think about. Yes, that's why it is important to have kind of functional dentures. It's also important because underlying kind of reasons that we speculate is that chewing function, right? So chewing function, if you have a good denture, you could still actually chewing better and have a healthier nutrition intake that can potentially have effect. But also that think about if you have a functional denture, that you potentially that you have a less inflammation potentially in your mouth. If you clean this well, that inflammation the level of inflammation can be less. So that also can be actually have some protective factors. So denture use can be potential as a kind of protective factor. But again, this is from our systematic review, and all these studies are conducted using observational study.
Yeah.
So I want to point out the caveats of this. So that don't quote me, say, hey, this is like it's a causal effect that we need to be careful about. This is all based on observational study. Yes. That we really, I want to say that there's so much more research that need to be done in this area, that need to have, for example, clinical trials, random RCT kind of studies to test this causal effect of this.
So I'm just trying to imagine, though, that pathway that we talk about. Like, we know sinuses provide, there's a pathway up to our brain from your teeth. Where does it go? Like, what is the pathway to our brains? What's the door from our gums up to our brain? Do we know?
Well, this is through kind of blood flow, right? So you have, because of the bacteria, that inflammation, the bacteria goes to your bloodstream, goes to your brain. So this is one kind of way to think about. And also that chewing ability that actually can kind of potentially increase your blood flow to brain. So this is all potentially speculation. And some based on these observational studies. These are the speculations.
So we have a question about the informational effect that you mentioned. Like, maybe we can explain to people what is, observational versus clinical. Now, observational is when we take a lot of data that's already out there and you look for commonalities or trends, right? So when you talk about substantiating some of these hypotheses in observational studies through clinical trials, what exactly would those trials look at? And I'm assuming they'd have to be pretty long-term, right? In order to understand what the data is indicating. So what's the natural course for research to go next to really understand conclusively if some of these observational trials are substantiated?
Yeah, observational data versus clinical trial, right? So a clinical trial you could potentially do is to potentially introduce that your treatment group introduce these kind of dental treatment, or like improve oral hygiene, this kind of intervention, then compared to this kind of care as usual group, then you follow, for example, 6 months or 1 year, that you could see some potential kind of changes in terms of cognitive function score. So that is one way for kind of these kind of studies, because you're basically in this highly controlled environment for clinical trial. You introduce one kind of we call active ingredients, then see how this ingredients works. Then everything else stay the same. Versus observational studies that you don't introduce any kind of interventions. You just look at the data and run and see if there's any relationship between X and Y. So right. That's what, right? You could, for example, that's why like longitudinal studies, you follow these individuals longitudinally, that you can see this kind of a time sequence, right? That whether this one you control for this kind of early on, then what happened in your like later on, like several years down the road, that how these individuals kind of health outcomes change. So it's looking at it as a predictor. It's a stronger than just cross-sectional kind of study. Yeah.
Right. Okay, well, thank you so much, Dr. Baywu, for coming and talking to us, sharing the insights from your latest research. Keep us posted. We hope that we can get some of these clinical trials going so that we have some more concrete answers, but it's definitely interesting to look at the trend. So thanks very much for sharing with us, and we wish you luck on your research.
Thank you very much. Thank you.
So if you've missed any of this interview and you want to see more, don't forget to go to beingpatient.com. Also, sign up for our newsletters on beingpatient.com, because that's when we tell you about upcoming talks with both experts and patient or people who have been diagnosed with dementia. We cover a lot of brain health topics as well. So thanks everyone for watching. See you next time.